Hi, this is Liron McCauley, and this is my Teach One video on the topic of benchmarking clinicians. In this presentation, I will answer the following question. The following data report patients with 10 diagnostic-related groups and 3 HCC indices cared for by a clinician and his peer group. Use SQL to determine if the clinician is more efficient than his peer group. So let's look at the data before we get into the analysis. The Excel file has 151 rows. We have the ID column, that's our key. We have DRG, that stands for Related Diagnostic Group. We have the HCC column, that stands for Hierarchical Condition Category. We have the doctor column that tells us whether the case was handled by the peer or by the clinician. And we have the LOS, which stands for length of stay. And it tells us the length of stay for each case. Before we continue, HCC and DRG are categories and groups scoring set that were designed by Medicare and Medicaid services. This will be the columns that we will use to stratify our data. There are 4 steps to the comparison. The first one is patients are described by covariates. In our case is the HCC and DRG columns. I will refer to our strata as patient types. For each provider group, we will calculate the probability of observing patient types. The third step is expected outcomes. The expected outcomes are the sum of product of the probability for patient types in each group. This is when we will also be answering our question. And we will do so by switching the distribution of clinician patients to evaluate how the peers perform on clinicians' patients. Okay, so enough with the talks, and let's get to work. Data was imported to SQL. The code on the right basically shows how the pattern for each provider was calculated, total number of patients, probability of patient type being observed by the provider, and average length of stay, each grouped by patient types. So it's pretty much self-explanatory. So the next step would be to match the data, to match our peer data to the clinician's data and look at what's missing and what matched. So what I'd like to do first is just do a regular full join and see what's going on. And what I do see here that on the peer end, we have 4 situations, 4 patient types. 1, 2, 3, and 4. Where this patients don't have this patient seen by the clinicians don't have a peer match. And we have 2 on the clinician end that are seen by the peers but are not seen by the clinicians. The next step would be to use synthetic cases for our missing data. And In order to do that, let's recode the matching table so we can use the missing patient type scoring from clinicians to peers and vice versa. So what we can see is that the output is a little different than the previous output. We can see that we have the same null, okay? All my 4 nulls on the peer group and my 2 nulls in the patient group. So the outcome remained null, but the scoring system is matched now. So what was null here, what was null in the HCC2 and the DRG2 is not null anymore, so I can know exactly which scoring system I'm missing an outcome for. This does not change the outcome because I do not use this for any calculation, just to match the data. You can see that the total cases remain zero, the probability is 0, and the outcome is null. And same goes for the patient, for the clinician. Before we handle synthetic cases, it is important to note that not all synthetic cases needs to be replaced with synthetic outcomes. We can ignore cases when clinician misses the patient, like in row 29 and 30, because the comparison is done on clinician's patients, so it does not change the outcome. We do address cases when missing by the peer groups and seen by the clinician. There are different techniques to calculate synthetic cases. What I use is the marginal average approach. However, there are regression approach and other models that you can use to complete the missing data. In this approach, what we did, we took the product of the average length of stay for each covariate in each provider group and divided it by the average length of stay in that particular group. So going back to my nulls, we can see, and I did not round it for a purpose so we can make it obvious that we calculated those by taking the average of HCC, the average of DRG, and then taking the entire average of everything and divided it by it. So it's pretty straightforward. Now we can answer a question. So to calculate the clinician length of stay, I simply multiplied the probability of observing that patient type multiplied by the length of stay, and that's 2.96. Then I calculated just to see what's going on the peer side. What would they do on their patients? They're 3.32. And then what I did was calculated the peers on clinicians. So how would the peers perform if they would see the clinician patient? So what I did was take the distributions of the clinician multiplied by the outcome, which is the length of stay of the peers. And this would be 3.03. Then I calculate the percent efficiency, and we can see that the clinician was more efficient than the peers by 2.4%. In summary, benchmarking is a technique used to compare providers based on patient types using the same sets of patients. In this presentation, I first created our strata based on HCC and DRG measures for each of our provider groups. Then I calculated probability of observing patient types, aka the distribution in each group. And third, I used synthetic cases to account for my missing data by the peers and seen by the clinicians. And the fourth step was to switch the probability of peer group with clinician group to simulate the outcome of peer group on clinician patient. This process can get a little bit confusing. However, if you do it step by step and break it down, it's actually quite simple. So that's it. Cheers.